Good afternoon and welcome everyone to our third session of the Public Health Alliance Regional Equity Learning Collaborative. We're so excited and pleased that so many of you could join us today. My name is Anna Bonilla. I use she, her, ella pronouns, and I'm the Health Equity and Justice Manager here with the Public Health Alliance of Southern California. And I'm coming to you today from unceded Tongva lands. And today I am joined by several of my Public Health Alliance colleagues, and I'd like to invite Savannah, who will be co-facilitating today's session with me, to introduce herself.
Good afternoon, everyone. Thanks, Anna. My name is Savannah North. I use she, her pronouns, and I'm the Climate and Health Equity Manager with the Public Health Alliance. I'm joining our session today from Ohlone Lands, and I'm very excited to be joining everyone this afternoon.
Thanks, Savannah. And for today's collaborative session, we will be holding space for conversations, cross-jurisdictional learning, and sharing strategies on how to move toward authentic community engagement and co-creation, and exploring power and how we can build in partnership with community. I also want to take a moment to thank you all for being here today and for making this work a priority for your team and for your community. I see so many familiar and returning faces, and I know we all have so many other commitments, so thank you for those that are able to make space and time for today. But also, I see all of you who are unable to make it today, and we'll make sure that these resources and the recording are available at a future date. And as I mentioned, if you're new to the space today, welcome. I know we have some folks that are joining us for the first time today, and we won't have space for a full round of introductions. So I encourage you to introduce yourselves by sharing your name, pronouns, and role or the jurisdiction that you belong to in the chat. And while we're doing that, I'd like to invite Bill Sadler, our Director of Operations and part of our leadership team at the Public Health Alliance, to share a few remarks.
Good afternoon, everyone. I'm Bill Sadler. I'm the Director of Operations here at the Alliance. I use he, him pronouns, and I live on unceded Tongva land. I'm really excited that you all could make it today. I know I've met many of you in different settings, and I think that today's session is going to be spectacular. We've seen the tremendous work that local health jurisdictions have done alongside community during the pandemic. Extraordinary feats of equity. We've seen examples working with farm workers. There's been vaccine equity efforts, testing, isolation, quarantine, culturally appropriate resources and communications, et cetera. We know you've really gone the extra mile to make sure that disproportionately impacted communities have received the resources they need. And now we're really excited as we move beyond the pandemic, even though we're still very much in it, to institutionalize these practices. Before we move on, I did want to spotlight a few wins that this collaborative has already had. This is our third session, so we're, I think, 6 months into the collaborative now. One department has formed an external advisory equity committee directly from support from our office hours. And then another department was inspired to hire their first equity staff. So those are just a few of the wins, and we'll continue to highlight these wins as we move forward. And now I'm going to turn it back to Anna to go over some training logistics.
Great. Thanks, Bill. So as a quick reminder, there's several points of Zoom housekeeping. I won't go into great detail, but we always like to lift up 2 points. The first is we always love to see your faces. So if you are in a space and place to turn on your camera, we strongly encourage you to do so. Second, I also want to take a moment to remind everyone that we're recording today's session, and the clips will be available on our website at a future date. We'll be sharing all of our resources on our Public Health Alliance Regional Equity Learning Collaborative webpage. And for those of you that were able to be with us last session, our former colleague Marley did a deep dive on moving beyond land acknowledgements and becoming better settlers. We already shared some of the links to the resources in the chat. And I also want to hold space today to acknowledge that our third virtual convening is taking place throughout the unceded territory of California, which is home to nearly 200 tribal nations. As we begin our time together, we want to collectively acknowledge and honor the original inhabitants of our various regions. And I encourage you all to visit the links to learn more. So during our last session, we took a deep dive to understand our role as health leaders to advance racial equity in a time when there is growing momentum around addressing racism as a public health crisis. We laid the groundwork and provided definitions and a common understanding that this is about racism and not race. We shared about the different levels in which racism operates, looking at the personal, interpersonal, institutional, and structural racism. And we also took some time to really deep dive into the role of government in creating and maintaining inequities through the example of redlining and how the effects of redlining are still felt in the health outcomes of our communities today. And we were able to be joined by leaders from the San Francisco Department of Public Health and the Seattle King County Department of Public Health as they shared about how they are advancing racial equity in their own departments and the steps it took to get there. So what can you expect from today? During our relatively short time, we'll start by beginning to lay the groundwork and unpack what we mean by community engagement and why we need to apply an equity lens around how we partner with community, acknowledging both past harms and power. This goes beyond a how-to of community engagement and really underscores the deeply rooted inequities that have systematically disenfranchised communities and created distrust of government-backed or led initiatives. We'll highlight how to move towards more equitable engagement from the start, acknowledging types of power imbalances, and how to move from transactional to transformational approaches with community. We'll also hold space for conversations around reflecting on your current organizational practices and assessing your departmental strengths and opportunities for growth. And lastly, we'll elevate promising practices and strategies that health departments can employ for authentic, sustainable, and institutionalized community engagement practices and partnerships. And just again, to review the agenda, we'll start by laying the groundwork, and then we'll have our first breakouts. We'll move into a break, and then we'll have our guest speaker from the Boston Public Health Commission. And then we'll have our second break, and then we will have time in our equity change teams. So to get us started, I wanted to play this video clip from a Q&A with Rinku Sen. Rinku has been a leading figure in the racial justice movement for the last 20 years. She has extensive practical experience on the ground in race, feminism, immigration, economic justice, philanthropy, and community organizing. Over the course of her career, Rinku has woven together journalism and organizing to further social change. In this clip, Rinku talks about her history and background as an organizer, working on campaigns that are targeted towards the actions of government agencies and leaders. And she reflects on the necessary partnership that community organizers and government must have to advance equity. And with that, I'll let her say it in her own words.
I'm struck at the end, you talked about the partnership between community and government. You've done this work now for 3 decades. Say a bit about the arc of your perspective on where government fits as a community advocate. Where you start and where you are now. And I remember the image, we were in Los Angeles yesterday having this conversation, and you mentioned maybe inadvertently you're chasing down a government official at one point. So say a bit about that.
Right. I mean, my early training is as an organizer and as a direct action membership-based community organizer. And in my earlier days, my feeling was government was only ever a target. It could never really be an ally, and certainly I didn't own it. It wasn't my government. But I said earlier that government is the end goal of democracy, and I think that idea is what has really become crystallized in my mind over this period, over the decades I've been doing the work, and that we own government, community owns government, and which part of the community gets to exercise control over government varies from place to place, and definitely money, of course, has a lot to do with it, but government, I think, actually is our best hope of achieving some of the kinds of outcomes we want. I don't think that the private sector is going to set up a system of privately funded education that is going to benefit all kids, and I think government has to do that. It's our only hope for doing that, making sure that every kid has access to a quality education. So when I was younger, though, government was always our target or our opponent, and And the chasing somebody down the street story was one of the earliest organizing campaigns that I ever worked on was a campaign to shut down a welfare hotel in San Francisco. It's 1988 or 89. I think it was 88. And we wanted a new health inspection done of the building, which was basically a slum and should never have passed a health inspection in the first place. And so we made an appointment with the then director of public health in San Francisco. And when we got to his office, he wasn't there. And they gave us, had us talk to an aide. But we had someone planted in the lobby. And as we came out of the elevator after, talking to the wrong person, the elevator doors opened and our colleague said, he just left the building. So we ran and, kids, TV cameras, everybody in tow, we ran and we caught up to him after a block and a half and we got a new health inspection. But now they're, so I think one important thing being in government that you can do is really support that kind of community organizing, speak up for it, defend it. It can be upsetting to be the target of a protest or organizing, I understand that. But thick skin makes good allies is my feeling. So helping all of your colleagues kind of process whatever feelings they might have when protests happen or when the community organizes, that's a really important role, I think, for government. And I think community and government can be allies to each other, but being allies to each other doesn't mean you never have conflict or that you don't have different strategies for getting your point across.
So one of the themes that's come up a lot.
Thanks everyone for bearing with me as I try to click around on my screen. It's hard to click and share the video at the same time. But I wanted to share this clip because I think it provides some foundational remarks on the relationship between community and government. And also, what it doesn't say, that community also are the government, the people that work at government are also part of the community. And I think she does a great job of talking about some of the ways that they can work together. And there were some quotes that really stood out to me as she was talking, government as the end goal of democracy, or that we own government and part of the community gets to exercise control over that. And, thinking about how, community and government can be allies to each other, but that being allies doesn't mean that there's never any conflict. I see that in Rinku's words, authentic community engagement and partnerships means allyship. It means that the line between community and government is blurred, and there are spaces that are created for the voice of the community to be heard and included, and that this is the right of community as co-owners of our public serving agencies.
I want to do a little bit of level setting also in this current context that we are presently in. And also thinking about sort of evolving and moving through and forward from. So really, why are we talking about practices and strategies around community engagement today? We all know very deeply that the COVID-19 pandemic has exacerbated existing health inequities among communities that have experienced legacies of oppression and systemic racism. And what does that have to do with community engagement? In response to these inequities, we've seen our health departments and all of you and those across the country really mobilize around an equitable response to the pandemic. This often meant establishing and strengthening community engagement and partnerships. These partnerships were forged with CBOs, with tribes, farm worker organizations, faith-based groups, community institutions, and many others, and really demonstrate the wealth of opportunity to sustain the lessons learned from these past 2 years and really think about how public health and community partners can work together to address health equity and racial justice going forward. Thanks, Anna. So let's define what we mean when we're talking about community engagement. I think we saw a lot of really important ideas on the Padlet just a moment ago, but to sort of share a common definition that we'll use going forward today and in this collaborative, we'll be using the term community engagement synonymously with other terms like public participation and civic engagement. For our intents and purposes, they're the same thing for the discussions that we'll be having. And today I want to share a definition that comes from PolicyLink and the Kirwan Institute that describes community engagement as a process through which community members are empowered to own the change they want to see, and involves communication, problem solving, governance, and decision-making skills and strategies. And I really like this definition because it brings in the element of power, which can often be overlooked when we're generally talking about community engagement. But it also talks about not just the communications aspect, but also the collaborative aspect, which is around problem solving, strategizing, decision-making, and really identifying shared goals and opportunities to achieve those. And I also want to acknowledge that this isn't the only definition of community engagement, and it is hard to choose just one. As was just demonstrated in our exercise, we each bring our own values, backgrounds, and perspectives to what we mean by community engagement, as well as what it looks like in our work and in our specific contexts. But also when we talk about community engagement, we also really need to do a deep dive into what we mean when we talk about community. Who is community? Who has been included or excluded in the past and in current community engagement efforts and partnerships? What does authentic community engagement look like? And what does it actually take to co-create strategies? So we aren't able to answer all of those questions today, but those are critical deliberations to have internally and externally with partners that you currently have and maybe that you don't have, to really build upon community engagement in your work. Next slide, please. So let's dive in a little bit to that first question. Who do we mean when we say community? The word community can be used as a broad term to define groups of people by their geography, racial, ethnic identity, gender and sexual orientation, age, ability, political interest, immigration status, etc. And when we engage in efforts to invite community members to forums or bring them to the table or set the table with them, as you might say, or to town halls, focus groups, and other collaborative spaces, we may often see that the same people are engaging and participating over and over again. And this is often a limited representation of the diverse communities that all of you serve. So when we apply a health equity lens to the way that we think about who is the community, we can see that there are legacies of oppression and structural and systemic barriers that are preventing people that have been disproportionately impacted by inequities from being at the table, and they're often unable to participate.
Thanks, Savannah. And I think that's really important to start going into this next piece, that engaging communities that have been disproportionately impacted by inequities, low-income people, people of color. This requires that we understand and acknowledge decades of government-sponsored segregation and disinvestment, which has left many residents with lack of access to opportunities and unable to participate and have a voice in community investments and decisions. Now, we don't have to look very far back in history to find examples of government-led initiatives that produce disproportionate harm to communities of color. We can look to a few examples that demonstrate how these policies, practices, and programs created and exacerbated conditions that led to generational health inequities and racial inequities, and generated distrust in engaging and partnering with government. In our nation, segregation is the result of a collection of historic plans, policies, and practices of racial exclusion and disinvestment that primarily targeted Black people and laid the foundation for the racial segregation of other people of color. In practice, these policies work to systematically deny Black people access to neighborhoods that were well-resourced and opportunity-rich. And they also simultaneously restricted where people of color could live and invest, spurring a cycle of disinvestment that contributed to failing schools, inadequate services, poor community conditions, and often led to high levels of crime and violence. Segregation, the concept of separate but equal, was anything but equal and even further from equitable. And the effects of this systemic and deliberate approach to separate people based on race and ethnicity is still reverberating in our neighborhoods and communities today. We talked about redlining last time, so I won't spend too much time here, but redlining refers to the federal government's practice of the 1930s rating of neighborhoods to determine which neighborhoods were risky to lend in. The Federal Homeowners Loan Corporation, an agency of the federal government, created color-coded maps evaluating 239 cities across the country for financial risk. The areas that were predominantly white, separated from areas with people of color, were given the color green. Green areas often had homes with deed restrictions, which meant that it could not be sold to a person of color in order to keep the area predominantly white. Areas that were more comprised of people of color were given the red distinctions, which meant they were not safe for loans. The practice, along with the other segregationist housing policies of the time, had lasting effects, from concentrating poverty to stifling homeownership rates, which has been a significant contributing factor to the Black-white wealth gap. And lastly, I wanted to touch upon urban renewal. In the 1960s and 70s, the federal government created the Urban Renewal Program to address inner city distress and remove blight, which often disproportionately impacted BIPOC communities. In alignment with these efforts, health advocates and the APHA, the American Public Health Association, put forth a set of guidelines for identifying blighted buildings and neighborhoods, which was then widely used to declare inner city areas as blighted. It provided the scientific reasoning behind the need to demolish whole neighborhoods and displace mostly low-income people of color. Local health departments even carried out some of the house-to-house inspections that documented the extent of blight and the range of substandard housing. Cities that participated in the program used eminent domain to condemn and clear housing and other properties in poor neighborhoods occupied by Black people and businesses and other people of color, and then planned to redevelop the land in accordance with city plans, which included things like convention centers and highways. Some residents were relocated to newly constructed public housing, but these were often built in isolated and undesirable areas, creating new neighborhoods of concentrated poverty and disadvantage. And over the course of the Urban Renewal Program, approximately 1 million people were displaced in 2,500 projects carried out in over 900 cities, and 75% of those displaced were people of color. Over time, many residents in these communities have lost the structural and cultural supports necessary to ensure justice and to achieve successful outcomes in their lives. These residents also and communities face additional barriers and challenges to play an active and vital role in their community decision-making processes. And civic engagement is often viewed as a means of gathering consent for initiatives supported by those that hold wealth and power, rather than a means for empowering community. Because of these circumstances, both past and present, civic engagement has begun to lose legitimacy and effectiveness. But we can be intentional, thoughtful, and strategic in how we move forward. We can acknowledge and reckon with our history in order to guide local principles and values in how we engage with community. We can hold ourselves accountable to repairing past and present harms and ensure that we are intentionally inviting people that have been disproportionately impacted by systemic racism and inequities to co-create and envision spaces for authentic community engagement and partnership. This work takes time, and it requires us to acknowledge and shift the balance of power in our work in order to rebuild trust and build solutions for enduring health equity and racial justice. And I want to highlight the work of one of our local partners, the city of Long Beach. In Long Beach, they've begun this process of reckoning and acknowledgement around systemic racism and oppression in the wake of the murder of George Floyd. And they participated in a citywide engagement process spurred by the council's adoption of the framework for reconciliation, which outlines key steps to ending systemic racism. And the 4 steps are acknowledging the existence and longstanding impacts of systemic racism in Long Beach and the country, listening to accounts and experiences of racial injustice, inequity, or harm to community members, convening stakeholders to analyze feedback from the listening sessions and racial disparity data to recommend initiatives that shape policy, budgetary, charter, and programmatic reform, and catalyzing action that includes immediate action. This work, which was organized by staff from across city departments, formed the Racial Equity and Reconciliation Initiative team to implement the framework. And the resulting report reflects the 2 months of work by this team. I encourage you all to reach out to your partners in Long Beach and learn more about the work that they've done to acknowledge and reckon with their history and their past.
So let's talk more about power. Because really, in order to build trust and shift the balance of decision-making and co-creation, we must contend with power. So what is power? Who holds power? How can we build power? And importantly, when and how do we cede power? How would you define power? I encourage you to share your thoughts in the chat as we briefly talk through power in the next couple of slides. And just to preface this as well, we could spend many, many hours or days talking about this. So this is just a brief introduction of how to discuss power and what it looks like in our work. So power, as we're defining it today, is simply defined as having the ability to do the following things: the ability to name or define and shape language and narrative, the ability to decide, the ability to set the rule, standard, or policy, the ability to change the rule, standard, or policy to serve your needs, and the ability to influence decision makers to make choices in favor of your cause, issue, or concern. And I want to draw your attention to the fact that each ability builds upon the previous to become broader and more impactful or sweeping. However, what's not explicitly named here in our working definition are the actors. And there are really 4 main ways in which power can manifest: personal, social, institutional, and structural levels. So if you recall from a previous session, these levels actually mirror the levels of racism that we discussed in our session around addressing racism as a public health crisis. And I want to walk through each of these 4 levels and share a few of examples. So there's personal power or internalized power, and that looks like self-determination, the power that an individual possesses or builds in their personal life. And an example of this is when a person chooses a new name for themselves rather than the one given to them. That is an act of personal power. Social power or interpersonal power is around communal self-determination. And it's really a grassroots collective organization of personal power, and power that social groups possess or build among themselves to determine and shape their collective lives. One example to share is over the last few years, individuals who identify as multiracial or multi-ethnic have used their social power to really name themselves into existence and build a community around the shared experience of being multiracial or multi-ethnic. That growing social power of the multiracial and multi-ethnic community is a direct challenge to institutions premised on a binary understanding of race. There's also institutional power, which is really around the power to create and shape rules, policies, and actions of an institution. And to have institutional power is to be a decision maker or to have great influence over a decision maker within an institution. So for example, a school principal or the PTA of a local school may have institutional power over that school. And our sort of highest level of power is structural power. And to have structural power is to create and shape the rules, policies, and actions that govern multiple or intersecting institutions or industries. And it's really critical to examine power at all of these levels, both as individuals, but also as those working in a department and working in a public health system. We need to understand where, as health leaders, we derive power in our roles and how to ensure that individuals and communities can have influence over institutional and structural power.
So as we're talking about power, we need to start talking about shifting or sharing power, and that requires fundamental changes. Power dynamics are often a major factor that shapes one's experience in a community. So it is often impossible to change power dynamics without some disruptions, and we're here to disrupt systems and change systems. So I wanted to, bring in this concept of power building, which many of you are already familiar with. And we're defining power building as a set of strategies used by communities most impacted by structural inequity to develop, sustain, and grow an organized base of people who act together through democratic structures to set agendas, shift public discourse, influence who makes decisions, and cultivate ongoing relationships of mutual accountability with decision makers that change systems and advance health equity. Community power building is particularly critical for communities that have been historically and disproportionately impacted by inequities and have been excluded from decision-making in their policies and practices that impact the health of the communities. And so I wanted to lift up a couple of examples of power building. The Power Building Partnerships for Health program, led by Human Impact Partners and supported by the Public Health Alliance, is just one example of how health departments can receive training and support in partnership with a community-based organization on how to build community power to advance systems and/or policy change to improve health equity. Over the past several years, we've had successful partnerships with some of our own member health departments that I want to elevate here, including Riverside's partnership with Starting Over Inc. and All of Us or None to build power of people who are formerly incarcerated and remove barriers to access housing. We have a partnership with Santa Barbara County in partnership with MyCop and Cause to build power of farm workers and access to field sanitation. And then most recently, we have the City of Long Beach that worked in partnership with Khmer Girls in Action, looking for ways to build power around housing justice and particularly aimed at strategies that would impact and address youth as well. These PPH partnerships have had several successes and impacts in their work. To name a few, CBOs and their members were able to access the table where the agenda was being set. Local health jurisdictions were better able to center community needs and more authentically and do that more intentionally. And community members, reported that they saw partnerships with government as possible, whereas they probably didn't see that as possible before. I'm sure that our participating member health departments that were part of the PPH cohorts would be able to and willing to share more about their experience. And I'm sure you can reach out to our partners here about their experience with these power building partnerships for health.
So as Anna just described, when we are able to harness the local health jurisdiction ability as power brokers and thinking about shifting, sharing, and ceding power, we begin to see the shift in that balance in community engagement and partnership strategies, and we can really start to transform community engagement and outcomes. For people to exercise their civic power and their voice equitably, we must change the way we think about civic engagement, making transformative changes in our longstanding customs, assumptions, policies, and institutions. It also means moving our conversations away from those that foster polarization and towards those that build relationships, foster mutual accountability, and strive for understanding among neighbors. And I just want to sort of harken back to what Rinku said, that doesn't mean there won't be disagreement or different strategies to reaching shared goals, but it means there is a place for conversation and reckoning with historic and ongoing harms. So we can think about this as a move from a transactional approach, which is focused on issue-based efforts that help individuals negotiate within existing structures and systems. And these solutions transact with the institutions for short-term gains for community, but do nothing to change the existing structures in place. So what do we mean when we talk about transactional approaches? These are often a one-way information exchange, such as a survey, a poll or a vote, or hosting a listening session. These can also be two-way information exchanges, but often the way information is relayed back to community is through inaccessible channels like an online posting or report back to a council meeting or something like that. So moving to a transformational approach means that initiatives are crossing multiple institutions, shifting towards proactive solutions. These solutions are fundamentally changing the way institutions are operating, thereby shifting cultural values and political will to create equity. Transformational approaches can look like co-creating agendas and priorities with community, holding them as co-developers and decision makers. or think more broadly about how and when we solicit not just community feedback after something's already been developed, but engaging in a collective brainstorming and planning process. It's including community voices in the initial planning phases that influence the subsequent and final outcomes of a program or goal. Really thinking about processes like participatory budgeting or community-based participatory research. So I want to build a little bit more upon the definition of community engagement that we shared earlier and share another that I think also incorporates a lot of these things that we're talking about today. When we start to talk about what we mean by equitable community engagement, we begin to see definitions that include an intention to engage historically and disproportionately impacted communities. And we begin to talk about transforming our approaches and shifting that balance of power. This definition of equitable community engagement comes from Seattle Department of Neighborhoods and defines equitable community engagement as a combination of processes that support the participation of people of color, immigrant and refugee communities, and low-income people in neighborhood groups, outreach and public engagement processes. It's about building strong and sustainable relationships, trusting relationships, increasing accessibility to facilities and services, and providing a range of opportunities to become involved in processes. It means that community priorities are reflected in organizational attitudes and values about developing equitable engagement.
Thanks, Savannah. So when we start thinking about, transforming and moving towards more transformational approaches and starting to think about adding an equitable intention for equity in our engagement, we can start to think about moving along a spectrum. And I wanted to introduce this spectrum of community engagement from facilitating power. It charts a pathway to strengthen and transform our work. And the stronger and more intentional we are in our work to partner and engage with communities, the further along we get to the right of the spectrum, and the more we can ensure that we are advancing health equity and racial justice. Each step along the spectrum is essential for building capacity for community collaboration and governance. These developmental stages allow us to recognize where we are and set goals for where we can go together through conscious and collective practice, which is key to transforming systems. Many of us may be starting at the informed stage, providing the community with relevant information. This could look like engaging community members to make public comment through existing forums. And if we're moving one step to the right to consult, this is where we start seeing more efforts to gather input from the community. This looks like hosting community forums, focus groups, or administering surveys. In this stage of the process, government agencies have already formed draft proposals before engaging community partners. We take another step to the right. It's when we get to the involved state. And that's where we ensure that community needs and assets are integrated into the process and inform the planning. Some of us are already doing this work through community advisory committees, equity impact assessments, or holding meetings with leadership and decision makers. The difference in this scenario is that government staff manage the proposal development and work with a number of community partners. Collaboration is where we really start to see great strides in transformation. In these scenarios, the proposal process is driven by a multi-stakeholder community partnership. Activities can include visioning and priority setting, assessments, development of metrics, and educational forums. And in the final step of the spectrum is when we are getting to deferring to the community. In this scenario, we are developing the capacity of the community to have increasingly more control over their vital community resources, such as food, housing, water, energy, etc. And this can look like consensus building, participatory action research, participatory budgeting, and other types of cooperative models. So as we are all embarking on this work, we just wanted to lay out some key foundational elements to really help ground you in this work, thinking about where you are in your community engagement process to build a common language, acknowledge and reckon with history. How have you examined and built power? How can you identify ways from moving to transactional to transformational approaches, assessing your departmental community engagement efforts, and then charting a plan to move forward. So welcome back, everyone. Hope you had a good break. I am really excited to have Trinice Polk, who is the Director of the Office of Racial Equity and Community Engagement at the Boston Public Health Commission, join us today as our special guest speaker. During the first part of our session, we talked about, laying the foundation of some of the fundamental elements that we feel that need to be really necessary to begin thinking about transformational community engagement, addressing your history, reckoning, assessing your capacity, things like that. And so now, our guest speaker will be talking about the more tangible pieces. How is this put into action into their own department and into their own work as well? So I'll introduce Trinice first, and then I'll hand the mic over to her. Trinice has been at the Boston Public Health Commission for 22 years, and in 2011 won the Frontline Award from the Massachusetts Public Health Association for innovative approaches to building partnerships with community. Trinice co-led the development of BPHC's first plan in 2016 and 19, and then recently updated the Equitable and Community Engagement Plan for 2020 to 2023, which provides a framework for the Boston Public Health Commission staff to engage Boston residents, especially those from historically marginalized communities of color, in government policies and interventions. She currently leads the BPHC Anti-Racism Intervention, and Trinice graduated from the Springfield College with a bachelor's degree of arts in human services and holds a master's of science in health communication from Boston University. And with that, I will hand it over to Trinice, and I will get your slides up in a moment.
You got it. Hi, everybody. Thank you, Anna, for that warm welcome. And thank you, everyone, for having me here today. I am really, really excited to be here to speak on behalf of the Boston Public Health Commission's Community Engagement Standard of Practice. And just so you know, community engagement is one of my biggest passions. So I can talk about community engagement anytime, anywhere, and for a long time. My presentation today will cover a couple of things: an overview of our community engagement framework, our process to develop our plan and framework, and some examples of how we bring our plan to life through strategies and action. Next slide, please. What you see here are front covers of BPHC's first and second edition community engagement plans. The life cycle of each plan is 3 years. And as you can see, the one on the far right, the second edition is scheduled to expire next year. So we are having conversations now behind the scenes to determine what the community engagement process will look and feel like to get this plan updated to a new 3-year plan. Next slide, please. So what you see on this slide outlines our community engagement framework. Our plan is supported by an internal community engagement policy, a set of strategies and actions, and a toolkit. The policy helps to reinforce accountability across the spectrum of our programs and departments. And as I mentioned earlier, I'll share some examples of strategies and actions that we use to help bring the plan to life, and I'll also describe a little bit of how our toolkit works. Next slide, please. So now I'll share with you how we co-developed our plan. And I never shy away from an opportunity to share publicly that when I was offered the opportunity to lead the development of building our community engagement plan, I kind of freaked out a little, maybe a lot. Because BPHC didn't have a community engagement plan or a blueprint for me to follow necessarily. So essentially, we were building a plan from scratch. And although I had done some research, of other organizations' plans and frameworks, in my research, I hadn't quite stumbled upon anything that described a step-by-step process to developing a community engagement plan. So one day, luckily, after taking a little bit of deep breaths here and there, I had an aha moment, right? And I realized that my job wasn't to develop the plan by myself in a bubble. My job was to establish an inclusive process. And let me tell you, like once I had my aha moment, I felt so relieved in knowing that I didn't have to figure it out by myself, and that my colleagues and my external partners were thrilled to participate in the process of developing the plan and to go on the journey with me. So the engagement process to develop our plan included these 3 methods of engagement: an external stakeholder committee, representative of employees from 3 organizations. So one of them was from the Center for Community Health Education and Research and Services that's ran out of our Northeastern University. Second group was members from Boston Alliance for Community Health, formerly known as BAC here in Boston, which served in Boston as a coalition convener. And the third group were representatives from Action for Boston Community Development, probably most known as ABCD. Our second method of engagement was staff community engagement work group, and there was approximately anywhere from 9 to 10 staff members in total that represented different bureaus and departments across the organization. And the final method was a survey. And the groups convened for approximately 9 months. I think it took us to develop a draft product, and the survey ran for approximately 2 months. And the main question that we asked group members and posed in our survey was, what should BPHC's community engagement plan aim to achieve? And boy, did the floodgates open. People had a lot to say and a lot of great ideas. Next slide, please. So what you see here are themes that resulted from stakeholder engagement from our first planning process. And I'll pause. I'll give you some time to take it in before we transition to the next slide. Next slide, please. And these, I didn't actually see it move, did it? Hold on, Anna, let me just make sure. Yep, okay, sorry. I've been having tech difficulties.
I'm on the second edition core theme slide.
Got it. Okay. So these themes resulted from the second planning process. And I'll give you some time to ponder here as well. But a lot kind of changed from the first time to the second go round, because stakeholders had a better understanding of the areas of opportunity for growth at BPHC. And some of those examples included that staff and stakeholders wanted us to create a process that would hold people accountable. And that's hence where the policy was born out of. And then also staff wanted us, and stakeholders, also wanted us to develop a toolkit to help support consistency and practice of community engagement, as well as to guide staff in how to apply the framework. And also for our guiding principles, we added, it was recommended that we add evaluated, because to give us an opportunity to not only assess ourselves, but to also give our partners or our community who would participate in our community engagement processes, to give us some feedback so we could, get an understanding of what their experiences were when they were hanging out with us during engagement. And another big deal that came around the second time around was that folk really wanted us to focus on following the community's lead. So rather than engage BPHC being the initiator of community engagement, they really wanted us to prioritize letting the community lead more frequently. And so as I go throughout the slides, I'm going to show you what our spectrum looks and feels like, and you'll be able to see a little bit better in terms of what I'm talking about in this example. And finally, an expanded definition of community, because when you say community, it sometimes, right, I'll just speak for the Boston Public Health Commission, we assume that it's the residents that we're serving, but staff reminded us that, hey, you know, we're required to live in the city of Boston if we work for the city. So we are residents. And so instead of going beyond, you know, the windows and doors of BPHC, perhaps there should be times where you consider engaging us first because we are residents of Boston as well. Next slide, please. So now I'll go on to describe our framework in more detail, starting with what you see here, our shared definition, and it's a kind of a bulky one. So it's the practice of using multiple strategies to provide opportunities for all Boston residents, particularly those historically excluded, underrepresented, or under-resourced, to be informed and to participate in public planning and decision-making to achieve an equitable outcome, as well as the guiding principles that you see on the right-hand side of this slide. And the principles that you see listed here represent our first edition community engagement plan, and I'll just pause for a second so you can take them in. And so the second edition yielded values including to be accountable, collaborate, to be equitable, to be inclusive, to be sustainable, and as I shared earlier, to make sure that we establish processes to not only evaluate or assess how we think we're doing in community engagement, but to give the community an opportunity to give us feedback based on their experiences so we can improve if we needed to. Next slide, please. So this, in my opinion, is the most meaningful part of our community engagement framework. This community engagement spectrum is an adaptation of the International Association for Public Participation's framework. And the reason why I feel as though that it's the most meaningful part of our framework is because it guides staff to determine which level that they're going to engage the community on, whether it's inform, consult, and as you can see, to going to the far right of the spectrum. You know, there's history of a lack of trust in government for varying reasons, but specifically as it relates to community engagement, the distrust often stems from a lack of transparency in process, including not being clear about who final decision makers are and not reporting back to those involved on what the final decision or outcome was. So this spectrum gives BPHC staff an opportunity to decide on the level of engagement, and in my opinion, you know, how much power we're willing to share or to give up. And to share that information up front before engagement begins as a way to help manage expectations. And this way, folk can opt in or opt out of any engagement opportunities. Again, knowing, you know, what they're either getting into, or again, just not interested in participating because it's not for them. So our spectrum on the top that you see, you can see that BPHC is the initiator, right? So we're engaging folk in an opportunity that we're leading. And remember, as I mentioned earlier, to be more intentional in following the community's lead, because in the community, like, they know, they're the experts. They know what they want, they know what they need. And so it was strongly recommended that we try to pivot and shift as best we could and work towards following more of the community's lead. So that's why we have in the second edition 2 versions of this community engagement spectrum. And there's still tons of work for that, you know, to really bring to life the second version, because again, the truth of the matter is it is, in my opinion, about sharing of power. And sometimes there's lots of, you know, bureaucracy and red line and all red tape, and things that come into play when you're engaging with the community. So it can be really, really difficult, but we're really doing our best to make sure that we're following the community's lead more frequently. Next slide. Okay, and finally, you know, our toolkit, you know, and I must share, right, to develop a toolkit, did surface the first time around. So when we were going through the process to develop the first community engagement plan, that recommendation came up then, but I didn't at the time have the the capacity or the resources to develop a toolkit. So we kind of just said, okay, we'll put it in a parking lot, and unfortunately didn't get around to it until it surfaced again the second time around. And that time around, I couldn't ignore folks' requests. So we put in the time and energy and effort to develop the toolkit. And our toolkit offers a step-by-step guide of how to put our guiding principles as well as our spectrum into practice. And what you see to the right of this slide are standard questions that we ask ourselves, again, to help kind of manage expectations as well as to try to put out fires before they start. It's like we do this kind of internal assessment before we start any type of engagement to determine whether engagement is needed or necessary. Next slide, please. Next slide. So now I'll take some time to share with you how we apply our community engagement framework. And so what you see here on this slide are a list of strategies that were recommended by stakeholders, and they include to develop a Racial Health Equity Advisory Committee, formerly known as Health Equity Advisory Committee, and also an internal group, and I'll give you some more specifics about these groups. An internal group, which is our Anti-Racism Advisory Committee. It was also suggested that we embed community engagement as a standard of practice everywhere we possibly could. And so we wanted to start with embedding language in our RFIs and RFRs, and also to commit to being in the community more frequently and having community conversations, and also to embed the language or a commitment to community engagement in our budget process, and also to develop equity plans across our departments and bureaus. Next slide, please. So what you see here, we've stood up 2 advisory committees, as I just mentioned. One is a resident-driven advisory group, Racial Health Equity Advisory Committee, and an internal group, which is staff-driven, which is the Anti-Racist Advisory Group. And each group meets monthly and operationally functions out of my department. However, each group is accessible to all departments within the BPHC to support their engagements as well. And these are just flyers that we've used over the years to publicize the opportunity for folk to complete an application to become members of these groups. Next slide, please. What you see here are photos of our most recently formed 3rd cohort. Members represent our Black and Brown residents and our priority neighborhoods. And as part of our selection process, we prioritize bringing on folks that have little to no experience with public health or the Boston Public Health Commission, because we know, right, there are folk who are historically missed or absent from government or decision-making. And so we want to be very, very intentional in lifting up those voices who are oftentimes absent or missed. And as I mentioned, they meet monthly and they're paid $50 for each meeting that they attend to compensate them for their lived experience and expertise. Next slide, please. So these are some other examples that we use to uplift or put our community engagement plan or frame into practice. We've used them we've partnered with both of our advisory committees that I mentioned earlier, and we've also extended opportunities to residents to help inform our strategic plan, to also inform our Boston's community health needs assessment and CHIP. And most recently, we used our community engagement framework to ask residents how they wanted us to use declaration funding. So about a year and a half ago, Boston declared racism a public health crisis, and we wanted to engage residents to have them tell us how they wanted us to distribute the resources that came along with those, Boston declaring, Boston declaring racism as a public health crisis, excuse me. So that was a great opportunity for us to do that, because again, it gives us an opportunity to let the community lead and not predict what we think they need or want, but we let them lead and they get to tell us what they want us to do, and then we distributed the funds accordingly. Next slide. Okay, and here are just a few more examples. Right before COVID, vaccine was released for COVID, we knew that it was really, really important to get ahead of that release. And so we wanted to hang out with residents to gauge their thoughts and opinions, and to ask, if they had any questions and concerns about, a vaccine that was going to be coming out soon. And so we engaged that residents in a conversation about, what did they need to feel confident in what was soon going to be a brand new vaccine across the world, but obviously also in Boston. And then these pictures that you see in the middle and to the right, the middle was us doing some prioritization. So from the CHIP process, the initial process yields some high level results, but we wanted to do some prioritization. So, and we also wanted to get to those voices that are historically missed. So we went really, really deep into the community and hung out with people who don't ordinarily participate in these types of processes. And these are just some pictures that we took, I guess, to brag and prove that we really, really did it. And then to the far right is an example of us hanging out with youth to have conversations about their mental health experiences. And similarly to what we did with the declaration funding process, we asked them what was missing for them in the community in terms of resources as it related to mental health. And they told us, and we distributed resources accordingly in terms of programming and services. Next slide, please. And most recently, we pushed ourselves a little bit further. It's usually my department doing that for the organization. And we embedded community engagement expectation questions in our budget process. So departments are required to describe how communities help them determine how resources will be distributed. As government, taxpayers, these are taxpayers' dollars, and residents should have a say. So we're practicing participatory budgeting. There's still lots of room to grow here, but I'm really, really proud of the fact that we are at least starting here, and we got the questions in the budget process, and all programs and all departments are required to answer every single question. So, and I have the privilege, my team and I have the privilege of reading all of the budget requests to help learn this, to see the stories and how they are in fact engaging either staff or residents in their process for budgeting. Next slide, please. So remember, earlier I mentioned an area of opportunity to build trust was to report back to stakeholders. Stakeholders often feel like sometimes we go into their communities, we ask them for feedback, and then they never hear from us again. And so my team and I launched what you see here, we asked, you said, we did, and what changed process. And so after every engagement, staff complete this, a form that's uploaded to the community, to our website. So we have it for our files, but then we're able to either print it out or send it to the community that we engaged, so they can see, what happened, after we hung out with them, and again, collect the data. We're able to report back the status of that engagement. And this process is getting a lot of great attention and a lot of great feedback from stakeholders, because again, they said that this was one of the areas for improvement to help to establish or build trust. Next slide, please. So, what have we learned? We've learned a ton. We're continuously learning. I would start with the basic stuff. To do community engagement thoroughly takes a lot of time, and time isn't always on our side because we have deadlines to meet. And we know that we can't make everyone happy, but we've learned that it's best to do something rather than to do nothing. So we try, to do what we can, to do what's, manageable and meaningful and respectful all at the same time. As I mentioned earlier, we learned the importance of managing expectations, and letting folks know who the final decision makers are and when to expect to get an update on the outcome. We've also learned the importance of being consistent, right? I hope I don't disrespect anyone or offend anyone on this call, but we've oftentimes heard that we're having one-night stands with the community, and they don't like that, right? They want us to be a consistent presence within the community and not just come to them when we need something. They want us to be there for them as well. And again, once the community engagement process has ended, continue to stay in touch. So some of the strategies that we've developed, right, we send regular check-in emails just to say hello, maybe, during holiday season, we send them holiday messages. Again, we attend their meetings and their events. Even, when we don't have an agenda, we're just going in and hanging out with them just because. And also, there's a point person on my team, so we want to keep communication open. So we identified a regular point of contact to make sure that the community can always reach us with questions, or again, to invite us somewhere, or to bring something to our attention that we may not be aware of. So they have access to the Boston Public Health Commission in that way through my department. We've also learned the value of accommodating people for their time, so through stipends or gift cards. We've also learned the value of reducing barriers, to participation by paying for transportation, providing food, daycare. This was all, of course, pre-COVID. And hopefully, we won't be going back to a normal. We'll be going, to a new normal, but hopefully someday when we're back in space again, I look forward to being able to break bread with some of our community members, And I would say finally, we've learned to have coverage, and courage, and try not to be afraid of the unknown. Sometimes it can be scary, going into communities and thinking, okay, I want to engage the community in this decision making or this process, and I'm afraid to ask them what they need or what they want, because they might ask for something that I can't provide. But first, it's all in the framing. You just got to frame the question in the right way, and don't make it seem like it's Christmas when it isn't. Again, it's about managing expectations, but have the courage to go out and hang with the people, because you'd be surprised. They're really, really excited to have you. And so it's really not as scary as it might seem. So that's it. I'll pause. I saw a lot going on in the chat, but I wasn't really following along because I was trying to make sure I covered everything. But I'll take questions now if you have them.
Great. Thank you so much, Trinice. And if we can all give a warm virtual round of applause for Trinice. Thank you so much for sharing your wisdom and your expertise. I was certainly taking notes. I have a lot of questions. I want to open it up for our collaborative members to ask their questions. So you can type your question in the chat, or we can have you raise your hand. But maybe it can kick us off while folks start formulating their questions a little bit. And you had mentioned accountability, and I heard that there's, levels of accountability. There's accountability to the community that you're working with, but then there's also accountability within your department and agencies to utilize this tool to help guide your work. So can you talk a little bit more about accountability within your department and agencies, and how are you sort of, ensuring that, you all as leaders are utilizing the tool, and maybe just expand on that a little more?
Yeah, that's a great question. So it lands in two areas. It's actually a goal, an expectation within our strategic plan. And also I mentioned, I didn't go into detail, but remember the slide that had, all of the examples of the strategies. I didn't elaborate on the one that's about programs and departments are going to be required to develop health equity plans, but it's going to be built into there as well. So they're going to be charged with describing very similarly, right, to the budget process, to describing how they use the framework and the toolkit and how they engaged folk in their processes. Again, it's transparency. So because we're government, right? There's that historical lack of trust in the things that we say and do, and there's good reason for that. And so we have to start to open ourselves up to having the community come in and help shape the decisions that are ultimately impacting their lives. And so it lands there, again, in the strategic plan, it lands in our budget process, and it also lands in our soon to come health equity plans. That's a requirement for every department in bureau.
I wanted to thank you so much for that, Trinice. And I wanted to just raise a question I see from Daniel coming in through the chat here, noting that relationships seem to be so crucial to the trust and the accountability piece and the sustainability of this work. And really thinking about how to best maintain these relationships when we're seeing across the country, such high turnover and burnout amongst our public health leadership and staff and partners. So do you have any thoughts on that, especially over the last 2 years, and strategies to support those relationships?
Yeah, that's a great question. One of the strategies that we took was, as you shared, right? COVID turned everything upside down, right? It was like, ooh, a doozy. And I'm looking forward to us, recovering from that. But obviously things have changed. And so what we did is we, took some of our, as I shared earlier, we're government. So there's tons of bureaucracy, tons of red tape, tons of unnecessary procedures and protocols. It's like, for what? Are you kidding me? Who made this up? This is completely unnecessary, right? So when COVID hit, we realized that a lot of our partner organizations were struggling. They couldn't even keep the doors open, right? And so a way that we help to maintain and sustain those relationships and demonstrate our commitment to them was we just started giving them resources, right? And we eliminated the processes of applying for this and having to complete this 20-page application, right? We reduced the barriers in that way and started to funnel money to our community-based organizations that were having a hard time and that were close to closing their doors and not being able to serve the populations that were hit hardest within Boston. So that's the best example I can give you right now. We just started pulling resources into neighborhoods and communities as quickly and as best we can. And again, eliminating all the bureaucracy and the red tape, because during COVID, none of that mattered, right? It didn't matter. we were trying to, save lives and keep people, afloat as best we could. And so I think that definitely helped. And also what it proved, right, is that, so pre-COVID, it's like we would sit in spaces and talk about, who we should be partnering with and how we could, strengthen our relationships, and we should be more collaborative and this and that. But then COVID required us to come together, right? And to do things that we hadn't historically been doing, right? But COVID required it of us. So we learned, in my opinion, COVID has been a gift and a curse. And so we learned from a lot of our historical mistakes, right? That again, that bureaucracy is completely unnecessary. Get out of the way, give the people what they need, and then they'll begin to believe and trust in us. So
thank you so much for that. And I echoed a quick follow-up that I wanted to just quickly ask is how or are those processes being reverted back to, or where have you found opportunities to maintain that sort of, quick response, reduce some of those barriers to getting dollars out the door to partners and helping support those relationships in that way?
Yeah, we're still doing that now, right? I still have, like, as I shared earlier, when racism was declared a public health crisis, a lot of resources came my way, through my department. And a lot of the, the community-based organizations, some of them have, been our partners for a long time, and they get it, and they know how to, navigate the system, and they're prepared, if you will, for lack of a better word or framing. But then there are some organizations that aren't. Take faith-based organizations. They don't have the infrastructure sometimes, right? They don't have grant writers. They don't, that's just not how they operate. But they're the ones that have the greatest access to the people we need. So we're, again, learning, from some historical mistakes or barriers that we've created, whether, intentional or not. And we're really sustaining, some of the best practices that we've established during COVID. And I just recently put out an RFR to help distribute some of the resources. It was one page. It was one page, and the expectations, we outlined it in like 3 bullets, right? It's like, no need to make this complicated, right? Give the people what they need, and give it to them quick.
I love that. I love that. I think that's something we could all really appreciate and would love to do. I think there's definitely some work to do there. But I'd love to bring some of our collaborative member voices into this space. And I see a question from Timothy Watts. Tim, if you wouldn't mind coming off of mute to ask your question, I can also ask it for you if you're unable to.
Yeah, sure. I shared in the chat. There was a discussion of an application process for the advisory groups, both internal and external, and I wonder if the application is seen as a barrier by the prospective participants, or if people are going to complete the application that's sort of like self-attesting that they're super engaged or bought in. So I just wonder if you have any thoughts or could clarify on that.
Yeah, it's a great question. So we're, as I shared, we just formed our 3rd cohort, and over the years, our, it gains popularity, interest, like skyrockets. And because what I believe is, the best outreach or community engagement is word of mouth. And so, right, it's like now word on the street is that the Boston Public Health Commission is, promoting this opportunity to become a racial health equity advisory committee. And that flyer gets sent around, by us, my brother and sister department, as well as our partners. And the applications come in. And that application, I believe, is probably, I think at best, maybe 2 pages. And the bulk of it, unfortunately, is more of a description of BPHC. And you know what I mean? It's kind of like we were required to do that. But the application is short, And we also offer up office hours. So anyone who, might have difficulty with completing the application, they can call in and my staff will help them complete the application online or via the phone, whatever assistance or guidance that they need. We also translate the document in the application into, I believe, 3 languages. The first one that comes to mind, I think, is definitely Spanish and Creole. And I forget the third one, I apologize. But we really, really do try to reduce or eliminate as many participation barriers as we possibly can. And the internal ARAC is our internal group. It has been established, I think, since 2018. So staff are really, really familiar with that group. And I haven't heard that the application process is a hindrance. But again, we're always prepared to remove any barriers that we feel as though is necessary or any feedback that we get from the community.
Yeah, thanks for taking the time to answer.
Yeah, no problem. Thanks for asking.
Thanks, Kim. And I can uplift another question and comment we have from Manuel. I think a significant component for creating effective community engagement strategies is organizational culture change, shifting engagement from being a checkbox to a way of conducting business. Can you share any strategies that you have come across that incentivize this culture change in organizations?
Oh boy.
I just wanted to also jump in. I know I'll let you answer that, but I also wanted to jump in and hope you can also share something a little bit about the unique position of your office as well in the organizational structure of your department, because I think that might add a little bit to what you shared. And Manuel, I see you're on camera. If we captured your question, if you have anything to add before we hand it over to Trinice. Okay, great.
Yeah, so we are uniquely positioned in the executive office, and that was intentional, right? So we're not seen as this kind of one-off independent department. And so it has been communicated to the entire organization that my department's responsibility is to help operationalize racial equity and justice frameworks across the spectrum of our programs in department. So everyone knows that this is to do, to work, through a racial equity and justice lens is an expectation. And everyone knows to apply our community engagement framework is an expectation as well. Now, does everyone go willingly? Absolutely not. That is not the case. I have to share that the first community engagement plan, although, right, we had a lot of interest and people were really excited about it, it didn't really quite take off, right? We were like beating a dead horse. Like, this is the thing, like, this is how we're supposed to help achieve equity. But this time around, this second plan, and as I shared with you, I think COVID has been a gift and a curse in many ways. And there has been a shift in people's way of thinking, our culture, and thinking, okay, one, we've heard Trinice and her team beat a dead horse and say over and over and over to prioritize community engagement. She has laid out every resource that she possibly could to make it really, really easy for us. And now, again, right, so much has gone on, dual pandemics, racism and COVID and so many other things. I think folk are really, really starting to catch on. And again, don't forget, right, my department is charged with, having embedded the expectations wherever we possibly can, right? So in our budget, everyone needs a budget. There's no way around it, right? You want to function, you need to put in a budget request. And guess what? This is one of the expectations. And one of the things that I did is, I started with City Hall because we're City Hall is like the mothership to us. And so I started with City Hall and pitching this idea of including community engagement and equity questions into our budget. And once they bought in,
the rest was history. I was like, oh, ding, 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 ding. It's a green light for BPHC. So now every single department has to do it. And what, as I mentioned earlier, there's always room for improvement, because what we have yet to figure out, although I have access to all of the budget requests and I can review them, what we don't have is a system, right? So it takes me time to, read through all of these budgets. And so now what's on our to-do list is to create some type of, performance database, right? Where we can actually track and someday be able to tell the story of how, either by, department or bureau or collectively as an organization, how many people, how many departments have included the voice of community in their decision making. And also at some point be able to tell the story of how much of our resources went to support and address to racial and health equity. So not quite there yet in terms of a system or a structure to like collect and hold that data and, and be able to help us but with reporting, but that's the next thing.
Thank you for that. And that last piece really sounds like a dashboard, almost like something that can be, used internally, but, maybe eventually externally, as well as another tool for accountability and transparency with community. And I'm looking at the time. I think we have time for maybe one or two questions. I don't see one in the chat right now, so I'm going to ask one of my own because I made my list. Okay. But you talked about being really intentional in the external committee about ensuring that people who were part of that committee were really people that did not have formal experience in this work. And I'm curious if you can share about, that process, like what types of trainings, what types of supports do you provide to community residents to help support their participation in these spaces? Thinking about, do they go through trainings or do they get lots of guidance from, staff that are there?
Yeah, that's a great question. From we're on our third cohort, as I shared, and we've learned a lot, as you continue to do things over and over, right? You learn and you evolve. And so what we learned by the time we got to the second cohort is that we needed to do a better job of making sure that the door swung both ways, right? And so not to just have the group there for us, right? When it's like, okay, you're gonna come and you're gonna give us feedback on this and X, Y, and Z, but to really also embed the opportunity for them to learn, right? So it is like a little or a lot, functions like a learning collaborative for them. So they come on board and they get 2 to 3 months, depending on what's going on at the time, 2 to 3 months of orientation. So it's a deep dive into who BPHC is, all of our programs, our departments. We also give them, during the application process, we ask them what they would like to learn or if there are any skills that they'd like to build. So we know that up front and we prepare our agendas accordingly. And also I shared that we give them, a $50 stipend, but we also have resources allocated for any additional skill building needs that they may have. Now, when our other brother and sister programs or departments want to engage HEAC, the charge is to come into that space and give an overview, right, of the issue or the topic. So not to just come, you can't just come in and, oh, what do you think or whatever, but give some context and some background. And that too is also getting them introduced to who we are and how we do things. So again, like I said, by the second cohort, we kind of figured out that it was only a one-way street and we needed to, do it a little bit better. And so, but by now it's definitely, the shared responsibility. We also have the members share an agenda setting. They also co-facilitate, right? And they bring to us, again, any issues that they're hearing or seeing on the ground that we may not have access to. So it's definitely a collaborative and shared responsibility.
Great, thank you for that. I think there's definitely a lot that I gleaned from what you said, and I just really want to uplift and elevate what you mentioned about, asking them what they want to learn and what they want to gain out of this experience. And, we can have the best trainings and orientations, but I think taking the time to tailor, and again, that does require resources and time. And I think that kind of really lends well into the time we'll have for the last question from Rashmi. And I'd love to invite you, Rashmi, to ask your question for Trinice.
Thank you. First of all, that was a really wonderful presentation, and
Thank you.
is absolutely amazing. My question was, how do you balance sometimes the timeline that happens that you need to meet either external funders, even federal funders, or other political or whatever other influences there are, with actually spending the time to do real community engagement rather than having it be just like a checkbox?
Amazing question. It's such a struggle. It is such a struggle. Oh boy, I can't even. Right, because it's my department who, again, as I shared earlier, like, this is my passion. Like, I can kind of just, in my mind, stop the clock and say, no, we have to prioritize this. Let's do it right. As my husband always says, it's like haste makes waste, and you'll be cleaning up a mess if you don't do it, try to do it right the first time. So I always have his voice and others in the back of my mind and wanting to do community engagement right. But sometimes we can't, and we rush and we make mistakes. And sometimes I have to say sorry for even situations that I didn't even participate in. I'm saying sorry for the collective. I'm like, oops, sorry, right? And I wasn't even there, but that comes with the territory. I say I find the balance in making sure that with respect to timelines, doing the best I can. At least, because remember, I think I said earlier, you'd rather do something than nothing, because you run the risk. So say, if we make a decision without hanging out with the people, right? And then it's like we impact them negatively. We didn't mean to. Of course, that's never our intention, right? But if we had just taken a little bit of time, right? Maybe not the 8 weeks that a real thorough process might take, but a couple weeks to hang out with whoever we could, you know what I mean? We could try to mitigate any harm that might get caused. So I would say, don't let the train leave the station without hanging out with at least the people that this particular decision could potentially impact, because you could learn a lot in such a short period of time. And you don't have to have this elaborate process, right? Sometimes people get stuck, maybe, right? Thinking, oh, right? The thought of planning a community engagement process can be overwhelming for people who don't do this, right? I'm a party planner, so I can plan in 5 seconds, but not everybody can do that, right? And so you have to understand, right? Who can do it and who can't. But I would say you can prevent a lot of fires even by just doing something, right? In a short period of time, rather than just saying, oh, I don't have time, let's just make this decision, because then something's going to happen. You're going to be, oh man, all I needed was a week or two, right? And I could have prevented this. And now I'm in this mess, and it's going to cost me more to fix it. So that's how I get through it. And know who the players are, right? So you're not, trying to start from scratch or reinvent the wheel, right? Knowing, right? Okay, again, I'm here at this place. I need to make this decision. I know this is where some existing data is. I know that, right? These are the players who have been on the ground doing this work. Like, find out who the players and the experts are. And they've done the work for you already.
Trinice, I wish we had so much more time with you. I feel like we've gotten such great questions from our members and participants, and I think I can just speak for myself. I just so am thankful for you being here and sharing your wisdom. And I just want to be mindful of your time. I see the sun shining through your window, and it's you're 3 hours ahead. So I hope that you get to enjoy the rest of your evening. So please, everyone, please join me in giving Trinice another virtual round of applause. Thank you so much. We so appreciate your time.
Yeah, not a problem at all. I'm happy to come back anytime you want me to. Remember, I can talk about this all the time, all day, forever. So,
well, I think you might get some folks wanting to reach out to you. So I will definitely connect you if that's okay. I can
totally. It's not a problem at all. I welcome it.
Wonderful. Well, we'll create a great group of people. Thanks so much.
Okay.